So, nandiyan yung recommended dietary allowance or vitamin B12. So, I'm 25 years old. Wala ko contract. So, ang dietary recommendation for 25 years old. Hi everybody! I'm Doc Mengay. Today I'm going to share with you about vitamin B12, also known as Cobalamin. Okay, start tayo. Okay, vitamin B12 or Cobalamin is one of the water-soluble vitamins. Kapag sinabi mong water-soluble vitamins, ito yung mga vitamins that can be dissolved in water and easily absorbed by our body. Any excess will be quickly excreted in our urine. Pero kasi iba yung vitamin B12. No, it can be stored in our liver for many years, around 3 to 5 years. Furthermore, vitamin B12 is made by anaerobic bacteria that can be found in the soil. So, no animal or plants can actually produce vitamin B12 or enough vitamin B12. Okay, may mga questions regarding vitamin B12 that we're going to answer. Okay, tingnan nyo dito sa left side ko. Question, how do animals get vitamin B12? Okay, first, the ruminants, yun yung cows and sheep, absorb vitamin B12 made by their gut bacteria. Kasi yung gut ng ruminants, merong anaerobic bacteria simply because they eat directly from the soil. Tapos yung water na kinukonsume nila, untreated water. However, yung mga farm animals naman, ang nilalagyan ng vitamin B12 supplement na yung feeds nila. So, nagkakaroon sila ng vitamin B12. Tapos, some animals, they get vitamin B12 sa poops. They eat poop, coprophagia, no, like rodents do. Tapos, yung ibang animals, they have bacterial contamination sa food nila, katulad nung nabanggit ko. And then, fourth, they eat animal source foods like other animal flesh, milk, or eggs. Okay, now, how do I get vitamin B12? Okay, actually, there are two varieties of edible algae that contains active vitamin B12. Yun yung green and purple algae. And some mushrooms and other fermented foods contain small amounts of vitamin B12. But then, they may not be reliable or enough sources of vitamin B12. So, the best way to get vitamin B12 is through supplementation. On my left side, you can see the recommended dietary allowance of vitamin B12. This is from NIH, National Institute of Health, 2021. So, nandiyan yung recommended dietary allowance of vitamin B12. So, I'm 25 years old. Wala ko contract. So, ang dietary recommendation for 25 years old is 2.4 microgram. So, for 14 years old and older, 2.5 microgram. Okay, ito pa isang question palagi. What form of vitamin B12 should I take? So, there are two forms. We have cyanocobalamin and methylcobalamin. Yung cyanocobalamin, they are better absorbed, and methylcobalamin, there's better retention. So, mas nasa-store siya. Actually, kahit alin dun sa dalawa can be taken because both can elevate vitamin B12 or they both prevent deficiency of vitamin B12. Okay, ito yung nagiging issue sa vitamin B12. Okay, meron study na lumabas. Ayan, nakalagay dito sa left side ko. High dose of vitamin B12 supplementation may be associated with an increased cancer risk in some groups. So, usually sa patients ko kasi, I prescribe vitamin B complex with low dose of vitamin B12 in them. Usually, nasa 10 to 20 micrograms. No? They can take it daily. Tapos, pwede rin naman yung vitamin B12 talaga in the form of cyanocobalamin or methylcobalamin, kung ano yung gusto ng patient. Kung saan sila comfortable, no? lowest dose that they can find, yun yung pinapatake ko, and then they could take it couple of times a week. But then you have to consult with your physician, no, kung anong vitamin B12 yung suited para sa inyo, dahil bawat tao iba-iba naman ang pangangailangan. So it is advisable talaga to consult with your doctor. Okay, yung vitamin B12 naman, hindi porket 10 microgram yung in-ingest mo, 10 microgram din yung ma-absorb mo. Yung absorption ng vitamin B12 will depend on the intrinsic factor in your gut. No, intrinsic factor is the chemical that shuttles vitamin B12 in our gut cells. So, sila yung nagpa-facilitate na absorption ng vitamin B12 sa katawan natin. Okay, next question. Should I get blood levels checked? Of course, lalo na pag hindi ka nagsusupplement on a regular basis. No? Baka kasi magkaroon ka ng deficiency. Okay, next question. Who is at risk for vitamin B12 deficiency? So, yung adults more than 50 years of age, they are at risk of vitamin B12 deficiency because very common sa kanila yung condition na atrophic gastritis. This is a condition wherein there is less production of acid in the stomach as well as intrinsic factor. So, apektado yung vitamin B12 absorption. Actually, the Institute of Medicine in US, they recommend supplementation of vitamin B12 regardless of the diet for people ages above 50 years of age. Okay, then second, those with gastrointestinal disease like celiac disease, Crohn's disease, pancreatic dysfunction, or history of bowel and stomach surgery. Okay, third, those who have lower vitamin B12 absorption due to medicines they're taking like yung proton pump inhibitor like omeprazole, pantoprazole, esomeprazole, yung mga nagtitake ng H2 blocker like famotidine, ranitidine, and those who are taking metformin, yung pang-diabetes. And then, of course, people with reduced or no intake of animal foods, usually yung mga whole food plant-based eater at saka yung mga pescatarian. Recommended talaga sa kanila mag-vitamin B12. Okay, ano ba yung mga problem na pwede mangyari kapag meron kang vitamin B12 deficiency? So, number 1 dyan yung anemia. Yung tinatawag na megaloblastic anemia. And, of course, yung neurological disorder. Yung tinatawag na subacute combined degeneration. If you want pala to have an online consultation with me, just go to my Facebook page and then send me a private message. Muna, if you like this video, don't forget to click the like button and subscribe to my awesome YouTube channel. Bye-bye!